Hi, I'm Dr. Jamil Smith, pediatric psychologist at Wayne Pediatrics, and welcome to this episode of Detroit Peds Talk. Well, if you have school age children, you're likely thinking about how to best protect them, not only from measles and mumps, but from new viruses currently impacting our lives and perhaps on the horizon. I have an amazing pediatric expert with me today who is well versed in this topic. She is a board certified pediatrician and serves as vice chair of medical education and clerkship director at Wayne Pediatrics. With nearly 30 years under her belt, she's received numerous awards and accolades, including recognition from the American Academy of Pediatrics for her work raising awareness for diversity, equity, and inclusion in medicine and in society at large. This amazing doctor is also a wife, a mom, and one of the coolest grandmothers I know. Please join me in welcoming to Detroit Pete's Talk, Dr. Lynn Smitherman.
Mhm. Good morning. Very nice to be here today.
Yes, thank you so much.
Mhm.
So, Dr. Smitherman, we're both moms and certainly can relate to the annual back to school ritual. For moms who may be experiencing this ritual for the first time, what
Mhm.
might be one piece of practical advice you can share based on your experience as a mom to
Mhm.
help another mom or dad prepare their children for the new school year?
So my kids thought I was absolutely crazy, but I would do a dry run the week before school started because over the summer things are kind of loosey goosey. They're staying up late, waking up late. They went to day camp, and it was there. There was some structure, but not as much as during the school year. And for me, I'm one of those people that have to kind of ease in, and in order to help my children ease into the routine of school, I would have a dry run the week ahead of time. So that meant, school usually started the Tuesday after Labor Day. So the week before, that Tuesday, the Tuesday before, I'd wake them up and early in the morning, get them up, make sure they got washed up, had breakfast, I'd kind of time it like, okay, we're going to do this. And then the Thursday or Friday before school started, I'd actually put them in the car and we drive to school and I time it. And they would just look at me like she has just lost her mind. But with the first day of school and so many things that could go wrong, at least we had that down. And
Yes.
that's not to say that the first day was flawless, because it wasn't by any means, but at least I knew what time I had to wake them up, how to have breakfast prepared, how to have all of the backpacks and everything packed and ready to go, and the
Right.
timing it would take. Because inevitably, the week before, there's not a lot of traffic on the road. So that first day, I had to account for at least another 10 or 15 minutes because everybody is trying to get to school on time. So that was my routine.
Oh, I love that, and I'm thinking to myself, why didn't I think about that? Because I say the first 3 weeks of school, right, are just such a huge adjustment. And
Yeah.
there's a crash about the third week when everybody's exhausted because you're adrenaline and you're trying to get used to the routine. So I love this idea of doing some preparation, even if it's just the timing of things or slowly getting into the groove, which can be
Mhm.
very helpful for children. So, as a pediatrician, what should parents do to best prepare their child for a healthy school year? And what are the required vaccinations for most school districts across the US?
So there's two sets of vaccines depending on the age of the child. So for the younger children that are entering preschool or kindergarten, most of the vaccines they should have had under their belt, and we're talking about mostly the booster shots that they get at 4 or 5 years of age. So they get the DTaP, which includes diphtheria, which is a really bad throat infection, tetanus, which causes lockjaw, and pertussis, which is whooping cough. So that's a booster that they usually get before they enter preschool. Then they also get a booster for polio. And then they get a booster for the measles, mumps, and rubella vaccine, the chickenpox vaccine or varicella. Hep B should already be taken care of, as well as the Haemophilus influenza, which causes a pretty nasty meningitis, and the pneumococcal vaccine, which causes another type of meningitis. So those should be under the belt before they start school. And then when we look at our older children that are starting middle school, we have the human papillomavirus vaccine, the HPV, the meningococcal vaccine, and that protects against not only blood poisoning, but meningitis as well. And the Tdap, which is the booster for the diphtheria, tetanus, and pertussis vaccine. So if they have all of those under their belts, they should be fairly ready to start school. And again, of course, later in the fall, the flu vaccine is going to be available. And so I really encourage families to consider it because children are going to be inside close quarters. And that's, when they get the flu, that's usually where they get it from. And now that we have the COVID vaccine that children from 6 months of age all the way up are eligible for, I ask families to strongly consider making sure that their children are protected against COVID.
Yeah. And so then you mentioned HPV for our middle schoolers. For older children in general, pubescent age, and those active in, let's say, organized sports, what are some illnesses that parents should be mindful of and perhaps discuss with their child's pediatrician or adolescent medicine doctor?
Mhm. So for those that are involved in sports, which I think first of all is great. I think the more active children are at whatever level they are, I think that's wonderful. But there's certain what we would call gym-related diseases that they can get exposed to that parents and the kids themselves should look out for, such as it's a long word, but it's methicillin-resistant staph aureus, or MRSA, or what we would call MRSA. And that's a skin infection. It can spread pretty easily. It's caused by a staph bacteria, and which you'll notice are a cluster of bumps in a certain area of the skin that just kind of get kind of crusted a little bit. It can be tender. Some kids have fever with it. And the problem with MRSA is that sometimes if it stays too long and is not treated, it can move from the skin inside the body and affect various organs. So it's very, very important that if, any rashes are noticed, to go ahead and get that taken care of, because you can treat it with antibiotics before it goes too far. Another common one, and MRSA, you would see a lot with skin contact sports. So of course, wrestling is one, but again, any skin contact, especially if it's indoors. So sometimes basketball, people don't think of basketball as a skin to skin or contact sport, but it can be. Even volleyball to a certain extent, any of those sports that your kids are coming in close contact with each other, you have to consider that. Ringworm is another skin infection, and even though it's not terminal and it doesn't go anywhere, it can spread like wildfire, particularly if because it's spread by abrasive contact, skin to skin. But the other thing is that if it gets in the scalp or if it gets under the nails, it can be a bear to take care of. We're talking at least 6 to 8 weeks of antibiotic that, especially if it's in the scalp or in the nails, either in the feet or, under the fingernails, because it can happen there. So even though it's not terminal, it's not fatal, it can be really, really difficult to get rid of in those areas. If it's just on the skin and limited to anywhere else on the body, a skin cream for about 2 weeks can get rid of it. And I usually tell parents to go ahead and keep the skin on, the cream on for at least another week after the rash goes away, because the fungus that causes ringworm is actually under the surface of the skin, and it takes a little bit longer for that cream to get there and penetrate. Warts is something else to consider. And again, it's skin to skin contact. It's caused by a virus. And usually you have to put some sort of topical solution on it to get away. The problem with warts is that sometimes it gets a little itchy, and if you scratch it, you can spread it to other parts of the body. And then finally, athlete's foot, which is another form of ringworm, but it gets in the feet, especially under the nails. And like I said before, it can be very, very difficult to get rid of. So those are some of the sports related diseases that you can get in older children. Then again, we have to go back to the vaccine preventable conditions that I mentioned: HPV, flu, meningococcemia, and then COVID. And there are vaccines for those. And so again, I strongly recommend for families to consider getting their children protected from all of those. And then unfortunately, we have non-vaccine preventable conditions that are just out there in the air, such as mononucleosis, which again is caused by a virus that can make kids sick for up to 6 weeks at a time. It's like the worst case of flu you've ever had, but it lasts a very long time with fatigue, body aches, fever, swollen glands, the whole bit. The problem is, especially with older kids, if it lasts for long periods of time, the spleen can become affected and it can cause problems there. So we want to make sure that the children rest for as long as they feel that they need to before starting activities, particularly sports again, and especially contact sports. Strep throat, they're going to get, it's in the air. Again, it's treatable with antibiotics, and you don't want it to go untreated because, again, it can manifest into heart conditions. So that's something that you want to look out for. And with strep throat, the kids have a very bad sore throat, fever, swollen glands in the neck. HIV and AIDS are on the rise in our community, unfortunately. And so we have to talk to our teenagers, especially in our adolescents, about if they're going to be sexually active, how to be as safe as possible and how to protect themselves and their partners. And then again, pneumonia. Pneumonia is out there, it's in the community, it's in the air basically, and again, it's treated with antibiotics. There are bacterial causes of pneumonia which respond to antibiotics, and there's viral forms of pneumonia which don't. And it's just, something that you have to rest and, let the bodies know. Children at this age should be able to let their bodies know when they're ready to participate in everything they're supposed to. And then finally, just general well-being. School can be stressful, as you know, Dr. Smith, for certain children, and we just have to keep listening to them and looking for things that might let us know that they might not be okay.
Yeah, yeah, and that's such an important consideration, especially when you're caring for big little people, as I call them. You still have to keep your eyes and ears on what's going on with them, medically as well as emotionally and socially, so that we can continue to support them. So, COVID-19 continues to be among us, unfortunately. What considerations should parents be making to protect their children and others in the classroom setting?
Yeah, that's a great question because you're right. It hasn't really gone anywhere. And it's interesting. I've kind of looked at some trends for a group that I was speaking to earlier this week. And what we're noticing is that, for example, when the state lifted the mask mandates, we saw another surge. And now we've got these variants coming out as well, which are also, causing some surges. But in terms of prevention, the first thing is to strongly consider having your children vaccinated against COVID. That's probably one of the best things to do. Now, it's not necessarily going to prevent people from getting it, but it's going to prevent them from getting serious disease. And that's what we're aiming for. We're trying to decrease the number of people that have to be hospitalized with COVID infection, because we're noticing that those who are not vaccinated have to come into the hospital and come in with a more advanced stage of disease and a more serious form of the disease. So that's very, very important to consider. Again, I strongly advocate social distancing. And sometimes with children, it's difficult. They're social creatures. They want to be next to each other, on top of each other, and all of that, especially the little ones, because they just don't quite understand. But to the best that we can, social distancing is very helpful. Hand washing, definitely. I don't care if you use soap and water or sanitizer. With my grandkids, I make sure every beginning of the year, I send cases of little pocket-sized hand sanitizers to everybody, just so they have them, so they just remember to keeping their hands clean. Wearing masks, I still am a very strong advocate, even though they've lifted the mandates of mask wearing, only because there's still some people that might be asymptomatic, which means they might have COVID, but just not have any symptoms. And the other thing is I have to be mindful. I'm around people all the time. I see well children in my clinical setting. I see sick children in my clinical setting, and I never know what I can pick up. So I want to definitely make sure that I am not at risk of passing COVID on to somebody else. I think that would just be horrible. And so just common sense things, but I strongly, strongly advocate all children from 6 months on up to get the COVID vaccine.
Yeah. Well, monkeypox, right, is a relative new term. What is it? And well, it's new to common language and how people are talking about the viruses that are going on. What is it, and how would you know if you have it?
It's very new within the last month or so, and it's now just taking over by wildfire, kind of like how COVID did when it first started. So we initially only saw it in adults, and now we're seeing cases with children. As a matter of fact, I was looking at a news report yesterday, and there two children, one in Massachusetts, and I forgot the state that the other one was in, that had it. So if adults get it, and if adults are around children, then children can get it. It is very contagious. And the problem is doctors are now just recognizing what it is and how to test for it. The few cases that we had at the beginning of the month, we weren't sure how to test for it. I mean, we see it, we assume it's chicken pox and like, oh, go home and do what you normally do for chicken pox. And it wasn't quite working. So we do know that it is spread by intimate contact, either skin to skin, saliva, or any other close contact with individuals who have it. Usually people we know have fever. The body aches, my understanding, are excruciating, meaning they're very, very, I mean, worse than what you would have for the flu. And listening to patients that have had monkeypox really talk about that's probably the rash is bad, but the body aches are probably worse than the rash. Now, the rash is distinctive. It's similar to chickenpox in that you start off with just a regular bump, and then it turns into a blister, and then that blister fills with pus. But unlike chickenpox, that the bumps tend to be a little bit smaller, these bumps are a lot larger. And even though you see them like on the body, the arms and legs, a lot of people get them on their face, and it is probably really, really devastating to wake up one morning and see your face covered with these really horrible bumps. And they all come at the same time. My understanding is that this infection lasts for just a few days. It doesn't last weeks or months like some of the other ones do, but between the body aches and the rash and just overall discomfort, it can be very, very distressing. There is a vaccine available. They are starting to roll it out. They'll probably first roll it out to frontline workers first, then make it available to the community at large. And there is a medication that's also available that they right now, again, are just starting to ramp up manufacture. And they're getting it to people that are prone to have more severe illness, especially those with underlying health conditions for it. But eventually, again, like the medication that's for COVID, will be available to the general public, I'm expecting within the next few months.
Okay. And can we anticipate that it will, be similarly available for children, that vaccine, how there was, older adolescents, and then, right now we're just getting the vaccine for the very little ones. So might we anticipate that that vaccine would be similarly available to the public in that way for children?
Right. And remember, with children, they want to make sure that it's effective and it's safe and dosing. So the vaccine that's available is very similar. I mean, many people in my generation have had the smallpox vaccine, and we got that vaccine as children. And the vaccine for smallpox has been worldwide, and it's been there for decades. And so the vaccine for monkeypox is similar to that. So I don't think that it'll take as long of a time to develop, ramp up, and test in terms of both being safe and effective for children.
Okay, okay. Um, Anything else on the horizon that parents should be mindful of?
So I've also heard that there is new cases of hepatitis in children in the community. And instead of being associated with the hepatitis virus that we know is a virus that attacks the liver, There's another virus that typically causes the common cold in most people that has been shown to develop hepatitis or inflammation of the liver in children. There have just been a couple of cases so far that have been in the news. And we don't know yet what made these particular children susceptible to it. My understanding is that these were healthy children under the age of 5 that just all of a sudden just got very sick. Things to be concerned about are very severe abdominal pain with fever. And most of the time, the parents will bring their kids in because they're thinking, could this be appendicitis? And they're finding out that it's not the appendix that's a problem, but it's actually inflammation of the liver. And that can be determined by various blood tests that would show that the chemicals that are usually in the liver are elevated, and that's what alerts doctors know what's going on. So that's one thing. I'm not sure if there's any treatment right now other than close watching, maybe IV fluids to make sure that the children don't get dehydrated, and pain control. So more should be coming regarding this in the next few weeks as we learn more about it and as more children get affected. The other thing, as I mentioned a little bit earlier, are the various COVID variants that are out there. So when we started, the first variant that we had was the Delta variant, and that caused a surge. Then we had Omicron last fall, just as school was starting, and that caused another surge. And then Omicron now has various subtypes. We had the BA4 that was pretty prominent, like, earlier this year, like in the winter, like January, February. And now we have the BA5 strain. And so some things to know about the BA5 Omicron strain of COVID is that it is highly contagious, but not as severe as we've seen in the previous variants. Like the Delta was not only highly contagious, but it caused more severe disease. The disease that the COVID BA5 strain is not as severe. The other interesting thing is that younger people, like young adults, are more affected than older adults, and taste and smell are not affected. So a lot of people think, oh, yeah, I have a fever, a little bit of sore throat, feeling tired, but my taste and smell are fine, so I don't have COVID. That's not it. So if you have those symptoms, you definitely want to check. The uptake, they think, is due to the relaxed COVID guidelines that we have now nationally. And the problem is, what the thought is, the reason why we're getting all these variants, first of all, variants are not new in any kind of viral infection. Like with the flu, for example, the flu vaccine changes every year because the variants change every year. And we look at what happened last year for flu, and that's how we make up the vaccine for the coming year to kind of predict what to expect the following year. We have not had years of experience with COVID, only 2 years. And the few variants that we've had, the Delta, the Omicron, and the subvariants of Omicron, we'll start learning about. So I can expect variations in the COVID vaccine as we move forward to address some of the variants that we're seeing. But a lot of people are concerned, oh, these are new variants, this is not expected. But no, it is very expected with any viral illness because we have individuals that are not immunized. And that's how we're able to see this infection still go through our community and morph or change, because there's still individuals that are not protected with the vaccine that are going to get it, and it's going to change in their bodies and they're going to pass it on to somebody else.
Yeah.
We have found that if you've had COVID before, it does not necessarily mean that you're going to be immune with this new variant. However, they have found that people that have been vaccinated and have had their booster vaccines might be better protected with these new variants.
Okay. That's really good to know how, these variants can be expected. Um, I think about as we talk about vaccinations and just being vigilant about protecting ourselves. Polio appears to be, making a comeback once was eradicated. What are your thoughts about this, and what can parents do to protect their children?
Well, it's really interesting because the reason why we eradicated polio in this country is because we vaccinate everybody against polio. So that's a beautiful case of how vaccines work. They work. I mean, we were able to get rid of it completely. The new cases that are coming in or from individuals from other countries where polio has not been eradicated. So that's a problem. And I know one of the things that have happened, especially during the pandemic, several primary care offices have had to close down for safety reasons. And so many of our children are behind on their vaccines. And so the ones who have not been vaccinated yet are vulnerable to getting polio. And polio is pretty serious. There are people in my generation, for example, who have contracted polio, and definitely in my parents' generation as well. It causes paralysis. It causes you to be paralyzed, particularly in the legs. And so it's something that if we can get rid of, that would be absolutely wonderful. The other thing we're seeing, especially over the pandemic, not only was it difficult getting access to get the routine vaccines, but I'm seeing in my practice more parents being hesitant to be vaccinated, even with those that are standard of care, so to speak. And my concern is that as families are becoming a little bit more hesitant, and I think it's because of so many missed messages that are out there in the media. Unfortunately, people are just confused and don't know who to trust. And I truly feel that everybody really wants to do the best for their children, but they want to make sure that whatever they're doing is safe and effective. And I truly understand that and I get that. But my concern is that we're going to see outcrops of polio, of measles, of chickenpox, again, because of the delay of getting everybody vaccinated and the hesitancy to do so.
Yes, yes. How do you handle, parents who have those reservations? How do you engage that conversation and provide that empathy and support?
So I think the first thing to do is to not be judgmental. And like I said, I think every parent wants the best for their children. And so as I'm looking at the immunization record, I'll approach it like I see that your child is behind on some vaccines. Is there a reason for that? And just let them open. They say, you know what, we have not been able to get to the office, or we've had so much chaos going on in our lives that we just haven't been able to. Or it could be, you know what, I'm really worried. I'm really scared. I've seen so many things happen over the last 2 years. I'm really worried. And that opens at least the conversation. And I applaud the parents that are brave enough to bring those concerns to their healthcare providers, because I can understand being concerned about being judged or being admonished or just, being told that they're wrong. And I think that, that just really shuts so many doors. So I, again, go through the benefits of vaccines, but I also talk about some of the risk as well, because not everything is completely risk-free.
Mhm.
And so I try to show a balanced picture as much as possible. And I ask them to please consider. And the other thing I tell them, that I would not tell them to do or ask them to do anything for their children that I haven't done for my own children. And one of the stories that I've shared, my daughter was a freshman at University of Michigan when the H1N1 flu was out. And I remember I was working at Children's Hospital at that time, and we had a 17-year-old football player in the ICU fighting for his life. And that was the age that H1N1 was attacking. It was these young, healthy teenagers and young adults. And so as soon as the vaccine became available, I grabbed a cooler. I went to the MAs in my clinic and I said, I need 2 doses of the H1N1 vaccine. And they said, fine, they gave it to me. I drove to Ann Arbor and immunized both my daughter and her roommate. Of course, I called the roommate's parents and said, this is what I'm doing. This is what I'm concerned. And they went ahead and gave me permission to do it. That's how afraid I was of seeing this and not wanting my child to get this virus and become deathly ill from it. So again, I've seen Haemophilus influenza. I've seen children come into the hospital with this and not come out. I've seen invasive pneumococcal disease. I've seen kids come into the hospital and not come out, or if they came out, they might have severe brain damage or other defects that might make them not be the same child they were before they get sick. I've seen many of these illnesses and it scares me to death. And for me, anything that I can do to prevent a child getting sick, I am more than happy to do that. If you want to, change the schedule a little bit, I'm okay with that. If you want to give one at a time, I'm okay. I'm very, very flexible. The bottom line is getting these children protected the best way we can.
Yes, yes. Well, thank you so much for this informative and enlightening conversation on vaccinations and what parents can do. We're so fortunate that we have you serving our community and our families. And I am certain that, our parents feel supported when they are with you and hearing this information. Back to school can be a very stressful time for families.
Mhm.
They have a number of anxieties and ways that they are trying to adjust to a new rhythm and new opportunities and new settings. And so, one of the things that I also recommend to parents is similar to how you approach the new school year is early on before the school year begins, opening the conversation,
Yeah.
um, getting into the routine, practicing the routine, but as well as having conversations about, what's one thing that you're looking forward to or that will be fun this year. And then what's something that you're scared about or worried about, because what that does is it normalizes the conversation. It normalizes identifying thoughts and feelings, and it gives a foundation for parents to be able to have a supportive conversation with their child. I also advocate parents modeling for them how to identify and discuss feelings, as well as sharing with their children what they do in a healthy way to manage stressful or anxious feelings. And so, sharing with your child, you know what, when I'm really worried about something, I'll go for a walk, or let's do some deep breathing together. Whatever it is that you do that's healthy, um, explicitly sharing that with your child so that they know, one, it's okay to have these feelings and thoughts, and two, this is what I do, this is what I experience, and this is how I take care of myself. These are ways that we can be just generally supportive to the adjustment of children as they approach the new school year. So I encourage parents to consult with their pediatrician regarding their child's unique vaccination needs, as well as, social and emotional adjustment for the new school year. Thank you so much for joining me today for Detroit Peds Talk. Thank you, Dr. Smitherman. For more information about Wayne Pediatrics, please visit waynepediatrics.org, and follow us on Instagram and Facebook for new episodes of Detroit Peds Talk, first Wednesday of each month. And remember, pediatricians are the best option for the medical needs of children. Take care.
Thank you.